Welcome to Mindfulness at MindMosaic, and this evening I was going to offer you a body scan practice, and if you would like to take part in it, then find a position that's comfortable, sitting in a chair, lying down, in your bed, it doesn't matter. I'm sitting on a cushion on the floor, and whatever position is comfortable for you and going to support you in taking part in this, then it's the right position. Just making sure you're comfortable and warm is the most important thing. So we're going to start and end with a bell, and if at any point during the practice you feel uncomfortable in your body or distressed in any way, then just stop, get up and move about. So just turning the focus of your attention first of all to the flow of breath in your body. Just noticing your in-breath and your out-breath. Just noticing how your body moves with your breath. Maybe taking a slightly deeper breath in and a slightly slower breath out. And just noticing now your body and the connection between your body and the chair or the ground that you're lying on. Notice the connection points, the contact points. Notice that sensation of contact. How does that feel? So noticing your whole body. Sitting in the chair, lying on the ground. Your whole body, from the left side, all the way across to the right side. From the back, through your body to the front. And from the inside of your body, all the way through to the outside. Your whole body, sitting in the chair, lying on the ground. I'm focusing now just on one part of the body, in the lower part of your body, and on your toes. Just notice your toes. Notice if they're surrounded by socks or covered by a blanket and what sensation that feels like. And notice any sensations that you feel in this part of your body. And if there are no sensations at all, then that's also okay. Just notice the sensations in this part of your body. And extend that out to all of your toes. And begin to notice now your foot, the top of your foot, the sole of your foot, the arch of your foot. Notice any sensations you feel here. You might notice sensations inside in the bones, in the ligaments, in the muscles. You might notice tension or tightness that might feel like pain. How does that sensation feel? And extend that focus up into your ankle. And just noticing any sensations that you feel in your ankle. Lots of bones in your ankle. And what do you notice about this part of the body? Noticing the bones and the soft tissues, and maybe noticing any temperature of the skin or anything touching the skin. And then moving the focus of your attention from your ankles just to your lower leg, and noticing your lower leg, the shin bone and the calf. Just an awareness of the bones deep inside and of the covered by muscle and skin, and then maybe clothes touching your skin. What sensations do you feel in this part of the body, in your lower legs? And if you notice that your mind is getting distracted and there are thoughts coming up, and then there's involvement with thoughts and thinking, and then before we know it we've a big story in our heads, just notice that with a curiosity, thinking, oh, there's where my mind has gone, and then turn back to the part of the body, to your legs, and noticing with curiosity the sensations that you feel in this part of the body. And if, when you notice these sensations, some of them you label as pain, then notice what part of the body that is in, and notice what that pain feels like in terms of the sensations. Is it tension or tightness? And as you breathe in, just direct your breath to that part of the body. And as you breathe out, then just imagine your breath flowing into this part of the body and softening around it. And moving the focus of your attention up now to your knees. What do your knees feel like? What do you notice here? Are they bent? Are they straight? What do you notice about the back of your knee? That soft tissue? And what do you notice about the front of the knee? The harder part of the knee where there's the bone, the kneecap. What sensations do you notice here? And moving the focus of your attention from your knee up to your upper leg, to your thigh, where the longest bone in the body is inside this part of the body, the femur. What does this part of the body feel like? Where you have this long bone and strong muscles all around it. They're helping keep you up and helping move you. How does this part of the body feel? And sliding that focus of attention now up to the pelvic area. And you might just notice the connection point between this part of the body and the ground or the chair. And notice what that connection feels like, what the pressure on this part of the body and this connection is like. And do you notice any tension or tightness? In this part of the body that cradles a lot of internal organs, an awareness that you might notice how your bladder feels, or your bowel. You might notice rumblings, or a tightness or a tension. How does it feel in this part of the body? And if we move the focus of our attention round to the back, in our lower back, how does this part of your body feel? Noticing the bones and the muscles. And just moving our attention slowly from this pelvic area up into the abdominal area, noticing all the organs held within the abdomen, and noticing at the back our spine. Just notice those vertebrae from the bottom of your back. Notice each vertebrae as it moves up. What do you notice about this part of your body? What sensations are here? And again, if you notice yourself labelling any feelings as pain, notice with curiosity what that sensation is like. Is it tight, hot? And breathing into that area. And as you breathe out, just imagine this area softening as the oxygen surrounds the tissues as you breathe out. And if you notice again, your mind's away off with a thought and into thinking, that's okay. Just notice with curiosity where your mind went. You might notice habitual patterns, just notice them with curiosity. And come back to your body. Your body is always in the here and now, bringing you into the present moment of what's actually happening in your body just now. So just coming back to our spine and moving up each vertebrae from our lower back to our middle back, noticing a slight curve, to our middle back, coming through between the shoulder blades, right up to the top of your neck, and noticing the weight of your head balanced on the top of your spine. If you notice your head feels heavy and you feel sleepy, or if you've noticed that you've fallen asleep and you've woken up again, that's perfectly normal. Sometimes in the body scan, you're kind of on this edge of falling asleep and you pull back to falling awake. But that's okay. Just notice, oh, I fell asleep. Notice there must have been tiredness. And moving from your spine, just back to your abdomen and noticing your belly. How does your belly feel? There might be rumblings, might feel full or empty. And moving up to your thoracic cavity, to your rib cage, where your heart and your lungs are contained. And you might just notice movement here. Well, what other sensations do you notice? As your body moves with your breath flowing in and out of your body, there might be an awareness of your heart. And then just moving up to the front of the chest. Noticing the pectoral muscles that surround your shoulder. How do your shoulders feel? Do you notice any particular sensations there? And are you labelling them in any way, such as tight or tense? Just breathe into that area. And as you breathe out, just softening around it. Noticing your arms, your upper arm, your elbows, your forearm and your hands. Well, what do you notice? Sensations do you notice in your hands? You might notice a connection between your hands and wherever they're resting. Notice your fingers, and palms, thumbs. And then moving back up to your neck and noticing your throat. And how does your throat feel? Inside? Whether there be dryness, and as you move round your neck to the back of your neck, just noticing again the head balancing on the neck. And shifting that focus of attention just up from your throat into your mouth and noticing your tongue, How's your tongue relaxing in your mouth? How does it feel? What sense is there of your tongue in your mouth and of your teeth and your jaw? Moving up across your cheekbones to your eyes. How do your eyes feel? They might feel heavy or dry and irritated or damp and moist. And taking that focus of attention from your eyes up over your forehead to the top of your head. And maybe just bringing the focus of attention again to your whole body. Your whole body. Sitting in the chair or lying on the ground. Your whole body surrounded by space. Above you, around you, below you. Your whole body resting. And may your mind learn from your body. And as your mind rests in your body, and your body rests on the ground. With nowhere to go and nothing to do. But just rest. And as we come towards the end of this meditation, just begin to gently move your fingers and toes, wheel your shoulders, become aware of your breath, and gently open your eyes if they were closed. And take any stillness and rest that you have found on into the rest of your life, that you might get the benefit from it, and that anyone you come into contact with in your life might also gain from that benefit. Thanks very much. See you next time.